Welcome to the video training, Health Literacy. Is your message understood? Hi, my name is Becki Hale. I'm the Special Projects and Initiatives Coordinator in Community Health Outreach, and I've been deeply involved in the area of health literacy since about 2010. It has positively affected the way in which I communicate at work, within our communities, and even with my family. Thank you for joining me today. In recent years, Cook Children's Community Health Outreach Department has hosted regional workshops to increase the knowledge of key topics necessary for doing community health work and creating lasting change. All of the coalitions led by Cook Children's will be viewing this training, along with other community partners working to improve health in our community, and most particularly the health of children. We hope these shared experiences add to our common language and continue to strengthen our various collaborations across the region. The key topic today is health literacy. Is your message understood? Before we begin learning tips to help improve our message, let's start with a 3-question quiz to help us understand what health literacy looks like. Question number 1. True or false? A person with low health literacy skills has a low IQ. False. Health literacy is not about intelligence. It's about making sure that all people have access to health information that is accurate, understandable, and actionable. In fact, low health literacy is often invisible. We must make no assumptions about literacy level based on someone's appearance, race, age, financial status, religion, or culture. Just like the different strengths of a cup of coffee, we all have varying strengths when it comes to learning and processing new information. Health literacy is about providing the information in a way that is supportive of the strengths of your target population. Question number 2. 1 out of 5 American adults read at a 5th grade level. Do you know the reading grade level for most healthcare materials? Most healthcare materials are written above a 10th grade level. Have you ever thought about the reading grade level of the educational materials in your organization? Have you checked? Checking the reading grade level can be easy to do. In fact, there are things we can do to our materials to lower the reading grade level. Providing materials at a lower grade level can be beneficial in any area of work, not just healthcare. This can apply to website content, surveys, instructions, and forms, educational pieces, even face-to-face verbal communication. Question number 3. Which is easier to understand or visualize? 2 centimeters or about the size of a walnut? I think most of us would agree it's easier to visualize about the size of a walnut. Measurements, especially metrics, can be abstract for many people. It's easier to understand when it's linked to something familiar. Car seat safety technicians with Safe Kids do this when teaching where car seat straps should hit and fasten. Instead of just saying 1 or 2 inches, they give reference points, like the chest clip should be at armpit level. Nearly 50% of all Americans struggle to understand numbers and math. And when we don't understand the numbers, we use emotions to help make health-related decisions. Do you teach and explain numbers, graphs, or concepts in your work? Most of us do. Remember, people who struggle with low health literacy may have trouble visualizing percentages and measurements. And providing materials to help explain what we're saying is helpful to most anyone. Health literacy is defined as the ability to obtain, process, and understand basic health information and services to make appropriate health-related decisions. Now, that definition isn't exactly health literate. So, what is health literacy exactly? Health literacy affects our process to read, write, listen, speak, solve basic math problems, and grasp visual and conceptual ideas. Think for a few seconds and imagine how frustrating and confusing it might be to process important information for those that struggle with these basic skills. Understanding concepts like why oral health is connected to overall health, connecting families to appropriate mental health services, explaining the correct serving size, and understanding protective factors for parenting can be a challenge to understand if the concept is unfamiliar to families. Those who struggle with health literacy often possess some of these behaviors. Take a look at these behaviors and think for a moment. How would these behaviors affect or interrupt the services that you provide? Why are we so concerned about health literacy? Well, the American Medical Association has now identified health literacy skills as the strongest predictor of health status, stronger than income level, education level, employment status, or racial or ethnic group. And families need health literacy to locate program services and maneuver the health system, to read information, follow health-related instructions, fill out and understand forms, and ultimately make responsible health-related decisions for themselves or their family members. I mentioned earlier that low health literacy skills are often invisible, and there isn't a stereotype. And the truth is, we all may struggle with health literacy at some point. More than 75 million adults in the United States possess limited health literacy skills. Nearly 9 out of 10 adults have difficulty using the everyday health information that's routinely available in our healthcare facilities, retail outlets, media, and communities. We all probably have some problems understanding some aspects of things, like trying to understand all aspects of the Affordable Care Act. As we provide information to others, we want to stop and keep that in mind. People have bad days and may seem disengaged for reasons we do not know. If we use our health literacy lens for the delivery of our messages, both verbal and written, it helps remove any stereotypes and keeps our information easily understood for everyone. Even higher level readers appreciate clear and simple instructions. Health literacy is something that we all need to be mindful of and incorporate into our work. Although what we do on a daily basis may be different from one another, communication is an important piece to most everything that we do. Health literacy involves effectively communicating our message to the intended audience, and we all want to do that well. Today I'm going to share how to use these 5 easy principles to help keep your message understood. Keep your sentences short and simple. Choose words that are familiar and culturally appropriate for the intended readers. Write in an active voice and keep our messages conversational. Be specific and concrete in our information. And aim for a reading grade level between 4th and 6th grade. Principle number 1. We want to keep our sentences short and simple because readers with low literacy skills have trouble reading longer sentences. Sentences with too much information make it hard to follow, and the reader may not be as able to remember what the first part of the sentence said by the time they get to the end of it. So, how do we keep our sentences short and simple? Well, here are 3 easy guidelines. Keep sentences at around 15 words or less. Use simple sentence structure. And consider using bulleted lists instead of lengthy sentences. Start reading this sentence. Yes, that is one sentence. You still reading? I thought so. Well, here's the same information, just presented a little differently. What a difference. Which one would you rather read? Remember those behaviors of low health literacy we talked about earlier? Well, when you were reading that first sentence, did you get lost in the details or get tired of reading? Really, no matter how strong our health literacy skills are, we all appreciate reading clear and concise information. So, how do we go from the first sentence to the information on the bottom? Ask yourself, what do the readers need to know? Rewrite your sentences with simple sentence structure. Edit your text again after you've rewritten it, and then ask someone else to read the information. The best practice is to test your material with someone from the target population. If you're not able to do that, ask a coworker or someone in another department. Even a friend or family member who's not as familiar with the topic can take a look at your information. Principle number 2. Readers with low literacy skills have trouble reading larger, longer words. Although we are often immersed in our topic area every day, the families that we serve are not, and words that might seem very common and plain to us may not be as common to others. Using more technical, unfamiliar words can also make people feel less confident and overwhelmed about making simple decisions. So how can we choose words that are familiar? Well, here are some considerations. Choose words that are less than 3 syllables and less than 6 letters. But then we all have those words that we just have to include that might be a little longer. So if you have to use a longer word, then teach with it. When you use a longer word, put an easier word or simple description in parentheses beside it to help teach the reader what the word means. Here are some examples. A great low-cost resource to help you find an easier word replacement is the Children's Writer's Word Book. This book can be purchased online at many retail websites, such as Amazon, Walmart.com, eBay, and it generally costs around $15 or less. It's not only a thesaurus, but it also tells you the grade level a particular word is typically learned. The built-in thesaurus on our computer in the Microsoft Suite is also a great way to find a simpler word. Just highlight a word, right-click, and a list of synonyms will appear. If you don't find what you're looking for, then just try the thesaurus. Sometimes it's easy to spot the longer, more difficult words, but what about abbreviations and acronyms? And what about jargon? We all have work-related vocabulary that is great for those that are submerged in that topic area every day. But for families who may not be as familiar with this information, our jargon can be very confusing. Here are a few examples of acronyms that could be misinterpreted. CPS, is that Child Passenger Safety or Child Protective Services? TB, is that toothbrush or tuberculosis test? Early Child Development, Healthcare Provider. Those acronyms could stand for many different things. And sometimes the acronyms look really similar to one another. Often, we like to spell words with our acronyms, and we forget these words have other meanings. There is nothing wrong with using abbreviations or acronyms, especially internally. We just need to remember to be mindful that when we communicate with clients and families, that our meaning is clear. Here's an example of how someone with low health literacy may struggle when reading complicated words. Pause the video to read through this and see if you can figure out all of the words. So, what is this content about? Well, here's the corrected version. Was it difficult to tell what the content was about when you first started reading? Did you get stuck trying to figure out a word before moving on? When a reader is not familiar with the content of our messages, it's easy to get lost and lose the whole meaning of what we want the reader to know or do. They may be stuck on a word and have trouble figuring out what it is we're even asking them to do. We also know that stronger readers may be able to use context clues to figure out words that they're not as familiar with. Well, those with lower literacy skills are not as able to use context clues, especially if the content itself is something they do not know very well. Another thing to think about is readers may sometimes think they do know the content really well, especially on a subject like brushing their child's teeth. If we do not use familiar words, the reader may assume the wrong information or message. Principle number 3. Another way to make information easier to read and understand is by using conversation style and active voice. Conversation style is something that you use every day, especially when talking to family members or coworkers. Even when we are talking to clients or presenting education to our target audience, we probably naturally use a conversation style. But sometimes we overlook using this in written materials. Writing in a conversation style makes our material more personal and not as cold, like you're just sitting down and having a conversation with someone and providing this information face to face. To help use conversation style in your writing, use you, your, and yours to address the reader and the person you're speaking to. Use I or we as the voice directing the action in the information piece of material. Take a look at this educational material on the screen. Do you see a couple of places where the word your is used? Using your helps the reader identify with this. If it had said, children's safety is important to us, the reader might think, whose children? Mine? Is this handout talking about me? Maybe this doesn't apply to me. But instead, the material says, your child's safety is important to us, and it does a really nice job using conversation style. Using active voice also helps make the reader the subject of the message or desired behavior of the material. The opposite of active voice is passive voice. We sometimes tend to write sentences in passive voice, but we want to make sure that we're writing them in active voice. In passive voice, the doer of the desired action is not really clear. And active voice makes it more clear to the reader that you're actually directing the information to them. Let's take a look at some active and passive examples. Here's an example of passive voice. Water safety resources will be shared at the event. Now, to make this active voice, we could say, come to the event for water safety resources. Let's take a look at another one. Here's another passive voice example. The attached form should be filled out and mailed back to us. This could be confusing. The reader might think, who's supposed to fill out the form? Am I supposed to? So to make this active voice, we could say, please fill out the attached form and mail it back to us. Let's do one more. Here's a passive voice example. Appointments can be scheduled by calling 555-1212. Pause the video and practice turning that last sentence into an active voice sentence. There's probably more than one way to make that last sentence active voice, but did you come up with something like, to schedule your appointment, please call 555-1212. Here are some tips to help us practice using more active voice. Avoid using ed or ing on the end of verbs. Avoid using any form of to be or was in front of verbs. Microsoft also has a great feature to help you recognize passive voice sentences. You can set your spelling and grammar check to catch and highlight passive sentences so you know which ones need to be changed to active voice. Principle number 4. Being direct and specific helps you hold the reader's or listener's attention. We have to be careful not to try and communicate too many things at once. If we try and say too much, we run the risk of losing our audience altogether. So in written materials, use bullets. This can minimize the amount of words, as well as make the information easier to read and look at. Use less description. This can be one of the toughest things to do because we think that everything we have to say is important. But we don't want to lose the reader halfway through. And know your audience. Ask yourself, is this a new topic or something they are familiar with? How much background information do you need to provide? When speaking verbally, we often tend to repeat or give a lot of explanation when educating someone face-to-face. Maybe we should just stop and check in, especially when we start to notice their eyes glaze over. Experts say that we speak about 50% more words than what our brains can process as a listener. So, in order to let the brain catch up, we can simply pause and ask, how are you doing? You doing okay? Short pauses are a great way for the speaker to help the listener stop and catch up. Another way to help ensure our message has been understood is through the use of teachback. Teachback is an evidence-based approach to improving communication and client health outcomes. It's a message for ensuring understanding in a non-shaming way. It's an indication of how well you communicated the information, not a test of the client or listener. It's a chance to check for understanding and, if necessary, re-explain and then check again without asking the question, do you understand? After explaining something, ask the listener to explain it back using their own words by saying something like, how would you explain this to your babysitter? Principle number 5. Remember, 1 in 5 American adults read at a 5th grade reading level. And that's why we want our written materials to be between a 4th and 6th grade reading level. There are ways to check the reading grade level of our information through readability tests. Readability software can help determine grade levels, but we also want to be careful that we don't sacrifice our content just to lower the grade level. We still want to make the content and message clear to the reader. So how can we do that? We know the principles that we've just talked about can help you lower the reading grade level. Shorter sentences, shorter, simpler words, active voice, concise and specific information, and bulleted information. And a great resource to help you know what the reading grade level is in Microsoft. It also has a built-in readability check. So to run this check, just go to the File tab, click on Options, click on Proofing, and then make sure that Show Readability Statistics is checked. There are other softwares available to purchase that run more tests to check readability as well. We know that there are more than just the principles that we mentioned today that affect health literacy. And cultural competency is one of those other things that has an important impact on health literacy. It's more than just the translation of your message into a different language. You could have the best fourth grade educational material on water safety, and if the images and colors and examples do not resonate with a certain cultural group, that can directly impact how well the message is understood and acted upon. The journey to communicate effectively is constantly evolving. The Community Health Outreach Department has found that using the principles of health literacy is making each of us better communicators. We hope that you can put these principles into use immediately, if you haven't already, in your own organization and even with your own family. There are many more aspects to health literacy than these that we were able to present to you today. If you're interested in learning more, here are some resources that I would recommend. Thank you for attending this training today.